All right, we can go ahead and get started. I hope that y'all can see PowerPoint presentation slide and not anything else.
Yeah, just the slide.
Okay, cool, because you probably don't care about anything else. Awesome. All right, so thank you all for taking time out of your day. This is the AFTO Drug Devices and Cosmetics Committee year-end meeting. And so for the agenda for this meeting, we'll do some quick introductions, talk about what the current committee charges were for this last year, discuss the AFTO and RAPS Healthcare Products Collaborative, and then bring up any hot topics and upcoming events, and then decide what we want our committee charges for next year to be. And please, this can be an interactive meeting, so welcome anybody to speak up whenever. And if you have any questions, like, please feel free to either put them in the chat or speak up or whatever. So to start out, so the committee leadership team for this committee is Mary Morgan, which I don't know if she's on yet, Megan Snyder, who is on, and myself, Laurel Aragona. And then our AFTO liaison is Steve. So I guess just a little introduction for myself. I am a regulatory affairs specialist for Smith & Nephew presently. And so I'm on the medical devices side. And I guess, Megan, do you want to introduce yourself?
Sure. Good morning, everybody. I am Megan Snyder. I work for the Texas Department of Health. I am the manager over the operations side of drugs and medical devices for Texas. That's all I got.
Thanks. And since we only have a few people, if you guys would like to introduce yourselves, you can go ahead and do so. If you can't speak, I completely understand. I know some places are loud and whatnot.
Well, I'm Jessica Deskins. I'm with AFTO. I'm just here hosting the call. Maybe I'll get people started.
Thanks, Jessica.
Yeah. I'm Brian Overton. I'm with Drager Medical Systems, Inc. on the medical device side.
Can you guys hear me?
Yes.
Yes.
Okay. Hi, I'm Jeremy Miller. I'm a 20-year tattoo veteran, as well as I do business coaching and consulting from a compliance and quality management system and process improvement side of things.
Hey, I'm Amy Bonsall. I work with the Association of Food and Drug Officials, and I work primarily on the healthcare collaborative part. So I'm just here for when we get to that conversation. If there are any questions, I can step in.
Anyone else want to introduce themselves?
Hi, I'm Natasha Hoagland. I work at Ink Projects. I'm the regulatory manager there. We manufacture tattoo inks.
All right, awesome. Well, thank you all for being here and introducing yourselves. So next is the our current committee charges, which were to, and I mean, some of them aren't really applicable, which is what we're going to talk about later. But charge one was to plan and identify important topics and secure presenters for the DDC program at the annual conference. Charge two, solicit mentors for first-time DDC attendees. Charge three is to advise the AFTO board of recommendation for increasing AFTO participation and ideas for increasing membership with drugs, devices, and cosmetic regulators and industries. And then charge 4 is to support the AFTO affiliates when requested by suggesting topics and speakers for their conferences. So charge 1 and charge 2 weren't applicable, ended up not being applicable to us this year because, which we'll get into next with the AFTO RAPS Healthcare Products Collaborative. But we didn't have a separate DDC program. We're not going to have one at the annual conference, and there wasn't a separate one. So charges 1 and 2 weren't applicable. And we are currently working with trying to get more people involved in talking with the AFTO board with how to do that. So if anybody has any suggestions for how to do that, or would like to kind of help lead that charge, that would be great. And then for charge 4, I believe that there's a list of SMEs basically that are able to speak at any of the AFTO affiliates conferences, and you can say which topics you're comfortable with. You can email myself, Megan or Mary, or especially Steve Morris, if you would like to do that. I guess Amy and Jessica, is there a place for people to sign up that are industry? I know there's a place for regulators.
I missed the first part of it because I'm sorry, my internet's kind of cutting out a little bit. So where do you want for them to sign up for what?
Oh, so like I didn't know if there was a place like besides emailing like Steve or one of the chairs to say that they're able to speak at the AFTO affiliate conferences to kind of go on that list.
That would probably be best, I would think. Amy,
Okay.
if you correct me, but yeah, I think just emailing Steve would probably be better.
Yeah, I think that would be best too.
Okay,
Yeah.
cool. Sounds good. Does anybody have any comments or questions or want to say anything about what our charges were this year? Alrighty. Well, then the AFTO and RAPS Healthcare Products Collaborative, RAPS, in case you're not familiar, is the Regulatory Affairs Professional Society. And so it's really cool that AFTO is now in a collaboration with them, because that means that we get access to a lot of things, and AFTO kind of can spread its word about what we do to their giant network as well. So the AFTO RAPS Healthcare Products Collaborative is a joint venture established in 2022 between the Association of Food and Drug Officials and the Regulatory Affairs Professional Society. Marla Phillips built these 4 meetings, starting with MedCon 15 years ago in conjunction with Xavier Health. The AFTO RAPS HPC is continuing and expanding upon Xavier Health's legacy. The collaborative supports idea sharing, innovation, and action across the global healthcare products community by fostering purpose-driven discussions between regulators, industry, academia, and thought leaders about the most pressing issues facing the industry. So yeah, and I'll go in a couple slides, I'll go through all of the conferences for that are coming up, and the different events that we hold for that. At this time, are there any questions about this collaboration. Okay. So just a little bit switching gears. This is by no means an all-inclusive list, but some of the hot topics I've been seeing pop up are definitely the Food and Drug Omnibus Reform Act of 2022. So December 29th of 2022, the president signed into law the Food and Drug Omnibus Reform Act of 2022 as part of the Consolidated Appropriations Act 2023. And the Food and Drug Act primarily amends the FDA, FDC, so the FDA Food, Drug, and Cosmetics Act, and the Public Health Service Act. The law enacts, I'm not going to go into detail about all of the things because we just don't have time. We could probably spend a whole day or more just discussing this. But the law enacts significant changes that will have considerable short and long-term effects on the industries that FDA regulates. So the various acts, or the act includes these 6 different subtitles. So reauthorizing different programs that were in effect. So kind of renewing those. There are some changes coming for drugs and biologics, as well as medical devices, infant formula, cosmetics, and then also some things regarding cross-cutting provisions. So the biggest ones that for us would be the drug, for this group, obviously the drugs, biologics, medical devices, and cosmetics. I know that the changes for cosmetics are kind of in the forefront at the current moment. So in regards to that, I'll jump over to the FDA public meeting, or FDA is holding a public meeting on June 1st. For the GMPs for cosmetic products. So during that meeting, anybody can join. It is free. If you go to the FDA website, there's a link there. Or I'm sure you could just Google that as well. Anybody can sign up, and this is an opportunity for folks in the cosmetic industry, especially manufacturers and distributors, to talk to the FDA and tell them how they think that they should be regulated, I guess, in a sense, and kind of give suggestions. By no means can the FDA guarantee that they are going to take all of the suggestions, but they want the public's opinion on and input on creating these more in-depth GMPs than what they currently have. Any questions, comments, anything about that? All right, and so I believe that for that meeting, I believe that the time for anybody to sign up to speak during that meeting has passed, but you can still sign up to attend and listen. Some other big things that have been in the works for a while really is the EU MDR, so the medical device regulation. That timeline keeps being pushed back as for when that will go into full effect. as because it is a whole lot of work for manufacturers. Again, that's another topic that we could probably talk days and days on. There have been updates to standards. Recently, two examples are ISO 14971 for risk management and ISO 20417 for the information supplied by the manufacturer. I know that there's plenty more. I'm sure Jeremy could tell us a lot about those. And then another big one is cybersecurity for all industries and AI. And then before I kind of turn it over to allow anybody else to talk, AFTO's annual educational conference is coming up next month in June in Norfolk, Virginia. So please sign up for that. There's going to be a body art track and cannabis track, as well as the food tracks. Are there any other topics that anybody wants to bring to the table? And this could also be things, maybe these can kind of help us shape what our next year's charges are going to be, or even start kind of doing like webinars or something like that to get more people involved with this committee. Anybody with anything drug specific? Because I know I talked more about medical device and cosmetics, since that's since I am in the medical device world mostly, and then involved with the body art, cosmetic, tattoo ink and whatnot, and products. Anything, I guess some things that have come up are like drug volume reporting and due dates for payment for different FDA programs. Anything anybody else is seeing or would like to know more about, or would like to talk about in future meetings or webinars or anything?
We are a real talkative bunch today. Sorry, Laurel.
All right, well, okay, I will keep going then. So the RAPS and AFTO Healthcare Products Collaborative events are these four. So there's the AI Summit, the Combination Product Summit, MedCon, and PharmaLink. So MedCon recently met for the first time since 2019 in person in April for 3 days for purpose-driven discussions that harmonize different perspectives to inspire collaboration, lead innovation, and make a difference in patient care. And that will tentatively be at the end of April next year. I know this year it was in Ohio, and I heard really good things from people in the industry about that. And I am excited that to go next year. I got word that I get to go next year, so that'll be fun. The AI Summit will be meeting in person in Cincinnati, Ohio in November to discuss a wide range of topics, build bridges to different ideas and concepts, and come away with action items and plans to move AI in healthcare forward. So I am sure that that will be a really interesting meeting, especially with all of the advances that are happening with AI basically daily, and that the FDA is has their guidance documents out and is kind of figuring out what to do with that. The combination products will be meeting in person later on in November in Fort Worth to discuss pressing issues and have dynamic conversations circling around the combination products in healthcare. And then the next PharmaLink conference is TBD. And 3 of the meetings are FDA co-sponsored, and the AI Summit is an FDA collaborative community. So it would definitely, I think it would be really interesting to be at any of those. And also, after being in the last board meeting for AFTO, these conferences are kind of taking place of the DDC track, since we do have the collaborative with RAPS. That doesn't mean that like this committee is going away. It just means that the attention and resources are really going to these FDA sponsored and RAPS and AFTO co-sponsorships with these events. Any questions?
Hi, this is Shannon Hosty. I'm not sure how familiar folks are with these conferences, but one of the, again, coming from Xavier Health, one of the, in the background for each of these conferences is if there is an established committee that supports the development of these conferences each year. So there's a committee for AI Summit, combination products. Each one has its own committee that is an active and ongoing organization and group of folks that are kind of driving and inviting the folks to come and speak to these and planning out the some of the key topics that are pertinent for each year.
Thanks for sharing that information. Anyone else? Any questions or anything? All right. Well, then the last slide that we have is to kind of come up with committee charges for next year. So in a few weeks, we the committee chairs, we need to provide a report, a committee report to the AFTO board. And at that time, we can get charges for next year approved. So I kind of took the liberty of removing charge 1 and 2, since we do not have an individual DDC program at the annual conference. And I left charges 3 and 4 because I do think that those 2 are still important and applicable. But as I said, this is an open conversation, and by no means is everything just what Laurel says. So does anybody have any ideas about charges we could do, considering like the things that I brought up today, such as the new like the omnibus bill, or anything AI, or anything with the cosmetic stuff, or anything with standards, the drug reporting, anything device related? Anything anybody wants to work on this next year?
So, hi, I'm Shannon Hosty. I'm new here. So forgive me if I'm speaking out of line, but there is one thing I know. I'll give a for example. I work in the human factors space, and we work on in both. Human factors applies to both combination products, medical devices, and even pure pharmaceuticals and biologics in some cases, because it's all about use safety. One of the things we've seen just in our piece of the space is on the combination product side, there's some organizations that have a venue for folks to gather and discuss current challenges in the regulatory space and challenges, in executing and conducting their activities. For example, the Combination Products Coalition, which I believe is run through a law firm, and then ISPE has communities of practice. And so they have groups where they get together and they talk about kind of some of the challenges they're facing within industry. And it gives them a chance to compile feedback and then interact with the agency in a way where, compiling feedback of here's some issues that we're facing. Can we talk about this? What we've been discussing in this space is that we don't really have a good way to do that from the medical device side. There's AdvaMed, but AdvaMed is very restrictive in its membership, and so not everybody has a voice or can have a voice in those committees, can participate in those committees. And I didn't know if AFTO would be an opportunity where if we created a communities of practice, and I don't know if it's just med device, but I mean, it probably could be larger. But the need I'm seeing right now is in med device, to bring folks together to have some of those discussions and be able to provide that feedback and maybe have some of these interactions with the agency.
I think that sounds like a great idea. And I mean, I think that is definitely a charge that we can propose to the board, and that could hopefully really help involvement with med device, but also in other industries as well.
Yeah, and because it'll pull in, right? If we can get the kind of critical mass to get those discussions to happen and provide meaningful feedback, that really drives some engagement as well.
Awesome. Yeah. And yeah, so we can add that as a charge and kind of start working together on scheduling out some times to start meeting to discuss those things, to definitely help out the other organizations too. Anyone else have any ideas?
No, but no, but I like her idea. I think that's a great idea as well, because I'm on the med device side as well. So thank you.
Any of our drug or cosmetic friends that are on the call?
I don't think I really have too much to contribute just yet, but wanted to tell you guys thank you for allowing me to come in and be a part of it. It's my first meeting, so I don't want to say too much just yet, but I do appreciate it.
Sure thing. Glad you could join us, Jeremy.
Hey, Jeremy, it's Casey. Glad you're here, bud.
Thank you, sir. Good to see you.
Okay, so does anybody want to, like I know Megan and I have talked in the past about trying to do some webinars on topics that people are interested in. So like maybe that's, I know like the AI and cybersecurity stuff is big. So like maybe we could find somebody to do that. Are there any other topics that people would like to have a webinar on, whether it's something you want to present or not? Just because you suggest a topic does not mean you're going to be asked to present by any means. Like it could be like EU MDR related, it could be drug reporting related, it could like anything.
It's not just thought. If we were thinking about potentially moving to build like a community of practice, I wonder if we could brainstorm through what are the key things people are facing and use the webinars to engage folks and say, hey, are you interested in talking about this more? Catch up with us here, right? And kind of use those as a jumping off point, maybe, to try to get some engagement too.
Yeah, I think that would be great. So I can definitely follow up with you, Shannon, and we can figure out how to get some things going and maybe start having some like preliminary meetings.
Yeah.
After like either like it could be after the summer. I know summertime is a busy time for everybody, but definitely like July or later to see to see how we can kind of get that rolling.
Yeah. It's like for the med device folks on the line, have you been hearing anything about some of the new EO information that's been coming out?
I have. I don't know if anyone else has, but yeah, I've been seeing that, and I know that's something that we're going to be having to deal with since we have EO sterilized devices.
That might be one, maybe.
Yeah,
I have something that I would be interested in, and I don't know if it would apply to everyone or just a select few in the group, but webinar series kind of structured around the idea of different certification to some of those ISO standards that you mentioned and a lot of others, but what that looks like, because I think a lot of people, especially from the manufacturing side, don't really know what it even really means. You can say you're going to get certified to a standard, but what the heck does that even mean? And what does it look like? So something to kind of walk through that path to say, it might not be as complicated and as scary as it seems, and talk about the benefits of what it could do and how it could kind of bridge these relationships between regulatory and government, and any kind of oversight to the manufacturer, but instead of looking at it from, we're here to kind of fight the government, instead you look at it from we're here to partner and make sure that we are setting things up that makes it easy and doable for the manufacturer, but also brings credibility and confidence to that regulatory authority.
Yeah, I think that's a great idea too, especially with new, I guess not new manufacturers, but manufacturers in certain industries, especially cosmetics across the board, having to are starting to be more regulated.
Yeah, or even some of those that might have been regulated in the past,
right,
but have kind of stuck in their ways, or don't see kind of where change coming in really even matters, but how they can kind of stay ahead of it. From my perspective, the goal of any kind of certification should always be continual improvement. So how do we kind of tailor the conversation back to that point of how does this help us all to improve?
Agreed. And I know, like, in I guess my day job, so to speak, we, like, with the constant updates and changes to standards, like making sure that those standards are understood, and we're like kind of doing gap assessments for your individual company and all that as well.
Wonder if it could be a way to kind of amplify the voice of the SBIA work that the FDA does.
Yeah, for sure. I'm taking notes. Sorry, guys. Anyone else? I know that, like, for EU MDR, there's been a whole lot more things as far as clinical evidence and post-market surveillance. So I don't know if other folks would be interested in something like that. And I know EU's a different story and monster from the FDA, but for all industries really.
We just have a webinar on navigating change, just in general.
Yeah. Putting that down. All right, well, does anybody else have anything they want to add or discuss or comment on or anything?
There's a chat message.
Okay. Yeah, so Selena has said some of the surveillance and documenting and notifications can be made easier with AI technology. That and she wouldn't mind talking about AI in this space for compliance. Awesome. I'm writing that down, Selena. Anyone else? All right, well.
Hey, Laurel, sorry, I couldn't get myself off of mute. You and I are in touch pretty frequently. You know what I've offered already to be able to provide as far as presentations and things of that nature. If you'd like to discuss that further with me, I'm open to that as well. I'm always open to any of the drug volume stuff, any of the electronic registration and listing stuff, any of that stuff I can present on in detail.
All right. Awesome. And I don't know, kind of along those lines a little bit. If it, I know for FDA, it's, I guess everything should be there, but for other countries, not necessarily. For the unique device identification, so UDIs, we could also talk about what that is and how to get that done if that is in any interest to anybody.
Let me just throw this out there because I think one of the reasons that I'm one of the few people that do what I do is because it's so boring to people. And so I say that in the context of this group, as we're trying to get this group to reestablish itself and to have some more life in the DDC committee for AFTO. Obviously, the things that are pressing are going to be whatever's relevant in the relevant industries at that time, whatever's useful and can be practiced or practicable at that time. But the nature of what I do is so boring, and I presented it previously at AFTO. What ends up happening whenever you sit there and talk about electronic registration and listing and details of labeling and yada 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 is like you kind of lose people, you know what I mean? And so for events like AFTO, and for the purposes of trying to reestablish the group and get people attracted to the group and whatnot, that's what kind of why I always drag my feet and hesitate to be like, hey, I can talk about registration and listing and blah 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 and electronic submissions and drone on about that for hours on end, but I don't want to sound like I'm not willing to. I just want to throw that out there that there's a difference between things that are real exciting and attractive to people and some of the things that we do as regulatory folks. And I know that we're in a place as the DDC committee to try and attract people to build a following here, because it's not as strong as it has been in the past. And so I just want to throw that out there, and let's keep that in mind, that like some of the more relevant things will be the things that really impact the manufacturer's bottom lines and things of that nature. And while I'm open to do registration and listing, I think the primary importance would be what's relevant and what will attract folks so that we get more people into the DDC committee. Thank you.
Thanks for sharing that, and I agree. Yeah, I mean, so much of it isn't necessarily exciting, but yeah.
But it's stuff you need to know, and maybe that fits into that kind of discussion, that SBIA kind of expansion discussion, because I could see a library of content around that being very valuable for folks when they need to know it. They need to figure out, they need to know how to learn, right? and how to access more information.
Right. And in my mind, I've always had, because I'm obviously in other groups as well, but I've always had the idea of, if we develop some type of training for whatever curriculum we're talking about, you have a basic training and you have an advanced training, right? So you have your normal stuff that you do on a yearly basis, and then you have your deep dive that you hire the expert for or whatnot. And it's always been kind of like, well, we want to have the basic curriculum for what it takes to survive in your regulated industry and your regulated market. We want that. I'd love to have that training set up for our AFTO DDC committee. And just like the problem is, everybody really needs to know it, but who's going to sit there and listen to us, or even go through it on their own for the amount of time that it takes to really get a comprehensive understanding of what GMP is or any of the other stuff. That's why we have folks that are trained as auditors and things of that nature. So I would love to see AFTO have, in their stockpile or their library, a basic curriculum and an advanced curriculum for all the regulated product types. But that's, I don't know how we would ever get that done. It's a great idea, and I agree with you that folks need to understand the very basics, but it's hard to get people to come to a educational conference or even to sign up for a webinar for a lot of the very basic stuff, which is really kind of like how you dot your I's and cross your T's in this industry. So.
Yeah, I know. I personally have, I may sign up for a lot of webinars, but I don't necessarily attend all of them, and I will play them as like kind of background noise while I work. But yeah, no, for sure to to engage in what people are really interested in, but also what they really need to know. The mundane. I know like some stuff is even like how to put together any kind, like the various types of submissions, whether it's to FDA, Health Canada, the EU, China, whatever it may be. But Yeah. So,
Well, with the
oh, go ahead.
context of in the context of SBIA, and I don't think that we're trying to fill the exact same role there as SBIA, but you know, SBIA has a YouTube page, right? And they have a whole what do you call it? A whole catalog of all of their presentations and training material that they've done over the last many years, or however many years they've been doing it. And I don't know if that's kind of like the same. I don't feel like AFTO is trying to fit that role so much. You know, we've got a big educational conference, but I certainly could see how we could try to do something similar to SBIA, right? Or extend that conversation like you were talking about.
Yeah. One thing that jogged on my mind as you guys were talking is I've release a lot of like newsletters on a regular basis, right? And one thing I've noticed is you have that new content or pressing issue, those get like the most people looking at them when they first come out, right? That gets that most attention there. But the ones that over time have the most people looking at them were the ones that were basically like, how do you create a risk management? How do you do a risk management table? You know, just the basics. Those are the ones that over time end up having the highest engagement. But it's people coming to it when they need it rather than, you know, it grabbing attention of a bunch of people right when it comes out.
I completely agree with that one. From
Yep.
old roles and present roles and all that. Yeah. And yeah, it's one of those things that is written in a kind of vague sense because like, but also there's specifics that need to be done.
Yeah, a little tactical, I guess.
Yeah.
Yeah.
All right.
It always surprises me, maybe because I've been doing it for too long, but because it seems second nature, you know, once you're doing something for 10, 20 years, just kind of how you see the world at that point. And then you realize that it is useful for people to hear kind of like you said, the mundane of how do you go about doing this? You know, because to someone that is a new way of thinking about things.
For sure. Yeah, I've even seen it with different reviewers having different perspectives, or
Yeah,
not
true.
knowing how to like just the way that they interpret your, I guess in this case, risk documents or tables.
Yeah. Something I've always wanted to do, and I don't know if it could be, if we could pull it off or not, but I worked in both industry and the FDA, and just sitting down and talking about communication between the two, like what are some of the challenges you face? What are some of the challenges you face? Like I remember, I know folks when they leave the FDA and come to industry, they're always surprised by like when a company receives a response from the FDA, it's, you know, suddenly there's a 30-person meeting and everyone is sitting around the table dissecting every word in that document for like the next, I don't know, 20 hours, right? And they're always surprised by that. And you know, and vice versa, right? It's just understanding the different perspectives. I've always wondered if it would be useful to kind of have one of those sit-down discussions of, you know, kind of building common ground of understanding the perspective of a regulator versus the perspective of a manufacturer. Not in nitty-gritty details, but just in communication.
Yeah, no, I agree with you because I've been on both sides as well.
Yeah.
And yeah, it is interesting how you think it is one way as you're a regulator,
Yes,
and how it's interpreted and things, and when in fact it's completely different.
yeah, and vice
on the
versa.
other end. Yeah, exactly.
Yeah.
And if you aren't, and there are so many people on both ends that aren't fortunate, I guess is the word I'm going to choose, to have both perspectives personally.
Yeah. Like when I first went into FDA from industry, it was interesting because I felt like I could put blinders on essentially because I was reviewing the data from a safety and effectiveness standpoint. But when I was in industry writing that, I had 50 million constraints and perspectives that were going into writing of that document, right? And things I need to satisfy with that document. But when I'm reviewing the data as a reviewer, I'm looking at the data from a safety and effectiveness. All the rest is noise, right? It's a different lens.
For sure. No, it's funny because my first FDA inspection I ever was part of a team to perform was for Smith and Nephew, and now I am working for Smith and Nephew. So different franchise, but yeah,
Yeah.
Smith and Nephew. It's definitely interesting and fun.
Yeah.
All right, well, we have 5 more minutes. It's been a great discussion.
Hey, I'll buy it.
Okay.
and maybe this is not necessarily. I'm just curious because you just said that you just said that you've worked for industry, but you're also working for you've worked for a regulatory agency, and now you're working for an industry member that you had conducted an inspection on.
Yes.
So I'm not trying to stir anything up. How do the conflicts of interest pan out? What are the details with respect to how a conflict of interest is avoided between the agency that you worked for and the company that you work for presently? Is there like a statute of limitations or something, or what is how does that work? Because I've not ever discussed this with anybody, not had the opportunity, so it's kind of interesting to me.
I can jump on that one if you want.
Oh yeah, go for it. Yeah,
It depends. It depends on your role in the agency, and basically your level of responsibility, and what that drives is the different statute of limitations. Meaning, do you have to have separation time between what you were doing at the agency and what you'll do in industry? That's one piece, and I'm saying this this is in layman's terms, right? I'm not an attorney or anything. But the other piece is there are certain things that don't have statute of limitations. Like if I was in the pre-market review side, so if I had reviewed a specific product, then there's some limitations on what I can do with that product in the future, kind of thing. But otherwise, it's controlled more through basically what was your level of responsibility in the agency. And what does that drive? And they have a whole, legal organization that manages that. It also even there's super tight restrictions around if you're thinking about leaving the agency, and what conversations you can have, and that you have to disclose those immediately, and all sorts of things like that. So there are a lot of controls in place around that to make sure that people aren't, behaving nefariously.
Yeah, and I mean, like for my journey, I well, I'm sure most people on this call know I worked with Casey at Pseudocol Labs after quitting my government job, and then moved to Smith and Nephew a couple years ago. And I am working in orthopedics for Smith and Nephew, but I was an inspector for their ENT devices. So
it sounds like everything else we deal with in regulatory, where I'm sitting here trying to paint with broad brushstrokes and get a general understanding, and it's really just every situation is its own, and you have to assess the situation for itself based on the context and the law.
Yeah. The reason it depends is the common answer, right?
Or the easy answer for all those regulatory folks is it's complicated.
Yeah. I'm back in industry myself. I was in industry and then like worked at the FDA and then came back into industry, but just make sure, you know, I'm just speaking as for myself.
All right. Well, we're at the top of the hour and I don't want to go into anybody else's other meetings. So thank you all for joining us and for the discussion. And I'm looking forward to this next year and kind of getting momentum going forward with this committee.
Thanks, Laurel.
Sure. Have a great rest of y'all's day.
Thank you. Thank you as well. Take care.
Thanks, Laurel.